Deductibles are the amount that you have to pay at full price before your insurance kicks in and pays its portion. Your bronze plans, that's your lower tier, the deductibles are typically around $7,500. A silver or a gold plan, those are typically your higher tiers. For the better plans in that tier, you got a $0 deductible, so you don't pay anything before the insurance comes in and pays its portion. For urgent care visit, your yearly checkup, specialist, that's like a dermatologist, you have a copay. That means even if you've hit your deductible or you haven't, you're only paying $20, $50, $10. And that's regardless of what services you get from them. The insurance that you get through your job, they kind of say, okay, here's your yearly enrollment. You're going to sign up or you don't have any health insurance. That's kind of how they low-key present it, but that's not the case. So if your job insurance costs more than 9.12% of your monthly income, you can switch to individual.
When I use my job insurance one time for my eye doctor, they pay half and I pay half. But I don't understand why I have to pay half if you come on my check every week.
The amount you're paying goes to the health insurance company. That does not lower your rates on that the health insurance company pays for anything. You paid half on that dental thing or vision?
Vision. So it's like my glasses was like $200 and they pay $100 and I had to pay the rest of it.
That is pretty standard. Most of the time with the vision plans, they have a set amount that they pay for glasses, a set amount for contacts, etc. And then you just have to pay the rest. That's something I might be able to help you with because I can pull up all the different vision plans and just get you the best one for you. Your yearly out-of-pocket max, that is the amount of money that they can charge you in a year, period. Mine's $1,800, right? So something crazy happens, I break a limb, all the bills are $50,000. They can only charge me $1,800 in a year. After that, all the covered services are free. A lady I worked with recently, she was in the hospital for 3 weeks. Just from staying in the hospital, she had like a $350 copay a day for staying. She hit her out-of-pocket max pretty soon, and then everything after that was free.
So you're saying her annual could have been $1,500. So she did that. She's all better. The year is still 6 months to the good. She's okay, and that keeps her out of debt as well.
Indeed.
That is wonderful.
Even more than that, right? She hit her yearly out-of-pocket max like 3-4 days into her 3-week stay while they're going into her and doing a bunch of stuff. So
Old people say
no telling.
Emergency away from bankrupt. The recruiter came in and shared with them, and the baby was about $25,000 that he would have had to pay just being a regular person. But not to say he didn't have insurance or anything, but the hospital bill was like $25,000 for that brand new baby. But insurance eats that up, and then recruited military is free, so you may get out of paying $11 for your baby.
She basically saying she good. I don't know about y'all, what y'all got going on. I'm good. I'm good. Y'all, however, you know.
Question. Okay, when you say that yearly deductible, what if I don't have an accident until December 31st?
This one.
It happened on December 31st, and I'm gonna pay $1,700 deductible. Then January the 1st, I gotta pay that $1,700 again.
$1,700 worth of services. You just now hitting your deductible, and now it's about to pay, and then it's the new year.
And I'm in the hospital for 3 months.
Then yes, you would have a new $1,700. However, the deductible is mostly for major stuff, ER visits, surgeries, inpatient and outpatient care. Your minor stuff is still just a copay. You don't have to hit that deductible before it's only a copay for your minor stuff. That's urgent care, yearly checkups, specialists. You see what I'm saying? She's nodding yes, but her eyes are saying no. My healthcare companies probably wouldn't even like that I'm giving that out. There is a way to make health insurance work in our favor, to make it help us keep money in our pocket. That guide is a way.
Nice. You're giving out.
So
doggone, that's
free game. Even if you don't get a
people will hoard and keep to themselves.
So that's something. Even if you don't get health insurance from me, or there's nothing else I can do for you, maybe I can offer that, and then I did just provide some value.
I'm confused. My child got Medicaid because she's medical fragile, but they ask you on the paper, do you have a second insurance just in case another insurance don't pay everything? Second insurance.
That may be talking about a supplemental insurance. It works different from regular health insurance in that it just pays cash benefits for whatever happens. It doesn't pay the doctor like your regular insurance does.
Well, can you hit on the topic of supplemental insurance for the people? Because I'm lost.
Supplemental insurance pays cash to you, regardless of what regular health insurance does. It does not pay the doctor. Yesterday, I was at one of my businesses. I do the employee benefits for them. They have stuff like short-term disability, a cancer plan, pays if you get a cancer diagnosis, critical illness, stuff for like heart attacks and strokes. And like I said, all of that pays you to do what you want with the money.